Hello, my name is Melissa and I am your orthopedic nurse navigator. In the next few minutes, this video will walk you through what will happen before, during, and after your upcoming surgery. We will show you people, equipment, and locations to better educate and inform you of everything you need to know. Once your surgery is scheduled, you'll be contacted by one of us and invited to attend Joint Camp. This is a great opportunity to learn in person what will happen before, during, and after your surgery. Joint Camp will give you the ability to meet some of the folks you will be working with during your stay with us. You don't want to miss this. We want this procedure to go smooth for you, and we will do anything we can to help. Hello, it's me again, Melissa. I will be calling you 1 to 2 weeks before your surgery to conduct the pre-operation interview. You will have to have these things handy when I call you: a list of your past surgeries or procedures, a list of your medications, vitamins and supplements, a list of any allergies you have. Our goal is to have you in good shape to return home as soon as you can after surgery. Right now I'm standing in the pre-op area where you will be admitted once the greeter checks you in. This is where the pre-op nurses will be checking your vitals and getting you ready for surgery.
Hello, I'm Becky. You can expect to stay up to 3 nights in the hospital after your surgery. You will be in a private room, much like this one. We will be checking on you frequently, day and night, to ensure that you remain stable during your stay. There are a few key things the nursing staff will be working with you on while you're here. The first thing that we need to do is manage your pain. If you're having a lot of pain, you aren't going to be able to do the things that we're going to need you to do. On the day of surgery, we'll most likely be giving you medication through your IV, and we will change to pills as soon as we're able to, because that's what you'll be going home on. We'll be working with you to find the medication that works best for you and how often you'll need it to stay comfortable. We will ask that you use a call bell to ring whenever you're having pain or if you need anything else. The next thing that we'll be working with you on is preventing blood clots. There are 2 things that we'll be doing. One is to be putting a device on your legs that acts much like a blood pressure cuff. It inflates and deflates and promotes good blood flow and prevents blood clots. The second thing we'll be doing is giving you medication that the surgeon will order on the day of your surgery. We'll start it here in the hospital, and it will continue when you go home. We will help you understand that medication so that when you go home, you'll know how and when to take it. The final thing that we'll be working with you on is preventing pneumonia. We will be asking you to get out of bed and walk. The staff will be assisting you with this, both nursing and physical therapy. We will also be using a device called an incentive spirometer if we have an physician's order for that, and that encourages deep breathing and expanding your lungs. If that is not ordered, we will at least be asking you to take frequent deep breaths. We will be asking you to do this several times during the day and also at night when you're awake.
Hello, my name is Jean. I'm a physical therapy assistant, and I'm just going to talk about what to expect from physical and occupational therapy while you're here during your stay. A physical therapist will come and evaluate you day of surgery. They'll be coming into your room and asking you a few questions, such as, how is your home set up? Will there be anybody to assist you when you go home? And if you have any equipment at home, such as a rolling walker or a pair of crutches. Part of the physical therapy evaluation is doing a functional mobility assessment. That consists of bed mobility. But prior to getting you out of bed, we want to make sure that you're safe. The surgical leg could be weak, so we'll use a knee immobilizer. This will prevent your knee from buckling when we're walking. Now that you have your knee immobilizer on, you're ready to get up out of bed and moving. We start everyone off with a front wheel walker, and then we will progress you to crutches if appropriate. Also, you will have an exercise program that you will be performing twice a day. The exercise program you will find in your packets. You will see physical therapy twice a day. If deemed necessary, you will have occupational come the next day and give you an evaluation also. Occupational therapy will be showing you how to get in and out of your car when you're ready for discharge from the hospital. Another piece that occupational therapy does is bathing and dressing. One thing that they can do is give you a piece of written handout from suppliers around the area that can give you some equipment if needed. They will also be showing you how to use some equipment for your activities of daily living that can help with your bathing and your dressing. Another thing that they can tell you about is how to make adaptations to your home, whether it be your toilet or your shower, so that you can get around your home safely. The physical and occupational therapy team communicate closely with the nursing staff to make sure that your pain is well controlled before our sessions. To maximize your safety, we don a gait belt with every patient before we get them out of bed.
Hello, my name is Sister Barbara. The goal at Discharge is to go home. This will happen rather quickly. Arrangements need to be made in advance for transportation. Ambulances are not an option, and insurances will not pay for an ambulance transport. Therefore, you need to make arrangements with your family, friends, or relatives. You also need to be sure that you have the appropriate vehicle. No high vehicles that you need to climb into, or a low vehicle that leads you to believe you might be sitting on the ground. Remember, you just had a joint replacement. You need time for it to heal, and you do not want to strain or have any compressions or dislocations to it. Another important aspect is insurance. When you come to the hospital, please bring a copy of your insurance card as well as a photo ID. We need your full legal name and date of birth in order to have our records correct. Insurance also plays an important part when you are ready to go to a rehab facility. Insurance companies will review your case and authorize your stay in a rehab facility. If they do not do so, the facility will not accept you. Insurance also plays a part in medications if you may need to use them when you go home. When you go home, you may continue your rehab by using an outpatient physical therapy service or a home health service that will send a therapist into your home. These services also need to be approved by your insurance company. To help facilitate your discharge, we also ask that you visit a local rehab facility if you think you will need their services. Ask what they can do for you after your discharge to make your life more independent. A list of these facilities will also be provided to you.
Thank you for taking the time to watch this very important video. We hope it was helpful. This was a lot of information, we know. Please spend some time reviewing your joint binder and plan to attend the joint camp before the surgery. You will be glad you did. You will be in great hands during your time here. The better informed you are, the better equipped you will be. If you have any questions, please call Melissa, your orthopedic nurse navigator, 907-1113.